Taking a deep breath. Cough. Can you cough?
The intensive care unit, or ICU, as you would hear, is a critical care area of the hospital where patients who are critically ill or patients who are very seriously ill are taken care of. What I mean by critically or seriously ill are patients who on their own may not be able to support their life and are requiring constant monitoring and intervention by doctors, nurses, and other medical staff.
Critical Care Fund, as it's called, simply means a fund that we're going to use to take care of patients who are in critical need. And what am I talking about? Patients who are brought in and they need emergency services, which include coming to the Korle Bu emergencies around, ICU, and some patients that may need emergency surgery. So this is supposed to support the needs of these patients.
One patient alone on arrival, first day, resuscitation and stabilization will take about 2,000 Ghana cedis. Very expensive. Then the subsequent days, close to about 2,000. So you can imagine if one patient is going to spend about a week or two, that's about 10,000. And most Ghanaians cannot afford. It's so expensive and they are having difficulties. Sometimes the relatives tell you point blank, I can't buy the drug, or I can't. Social welfare, and sometimes they are declared paupers. There's nothing you can do about it. They can't afford.
Well, Fidelity came around, as a bank, they want business. But as part of their corporate responsibility towards Ghana, they came around looking for business, and I also took the opportunity to tell them, well, you came in for business, you will do what you may, but this is also a need that we have as a hospital. What do you have for us? Said immediately, said, give us some few days, we'll get back to you. And we were here when they said, we are ready to partner you. We'll use all our branches countrywide to solicit. And we'll also help you to manage the fund for it to grow, so that day in, day out, we have enough funds to be able to solve these emergencies for people. And this is how they came in, and I'm very, very glad Fidelity is a partner in this.
I don't think anyone can underscore the importance of healthcare in any society, and most importantly in a developing nation like Ghana. And therefore, we believe as a bank that our support for a very laudable initiative as the Critical Care Fund is a step in the right direction.
Fidelity Bank is a young, emerging bank. We are the biggest private sector indigenous bank in this country. We're just about 9 years old and counting. We are determined to be the bank, the choice bank for the people of this country. We want to be in every community. We want our people to access our facilities, our services, and our products without having to travel long distances. We are a customer-centric bank. We are welcoming, we are warm, and we want our people, Ghanaians, to identify with their own bank. When you go to any country abroad, the local banks, the indigenous banks, lead the development of the countries, partnering government and the private sector to develop their countries abroad. And we want to be that bank for this country to support government business and also to support private initiatives like the Critical Care Fund.
I think it's a very important and a very good cause for every institution or individual to be able to contribute to this cause, as it could be something that could happen to any of us. It could be somebody who works with Fidelity Bank or any other bank or any other section of the society. It could be an individual, and at that point you'd really need attention from the emergency services of Korle Bu.
Korle Bu will remember, and for all those coming through Korle Bu and seeking clinical services, will forever be grateful to you. Tomorrow when you walk through Korle Bu and all our emergency services are up and running, then you know we have a good partner in Fidelity. So we want to say same to all those who want to come and partner. We will duly recognize you as you contribute your quota regularly to make sure that this fund grows and takes care of people of Ghana. I am excited about this, and I'm personally also going to contribute to this. Not only with my skills, but also with my money. And I want you to do the same.
I'm appealing to all Ghanaians to come and support this Critical Care Fund. Kitwebians, people say 5 cedi, 10 cedi, 20 Ghana kura, ebe bua manzi sanyaba. Who knew down so much, bet me I ochina, and I say ochina chi